Hello, this is Dr. Naqshbandi from American Dental Clinic in Erbil. Today's topic is about periodontal diseases in female. Periodontal disease is actually one of the most common diseases in the world. In developed countries, it goes beyond 20 to 50%. And in the United States in 2009, one of the surveys showed that more than 64 million Americans older than 30, they have some type of periodontal disease. However, this one is more common among the female, and it's because of the effect of hormonal changes in the female, especially during 5 situations in their life, which is puberty, menstrual cycle, if they are taking birth control, initially during pregnancy, and at the end in menopause situation. Now, during the puberty, what we see is an increase in hormones altogether, but 2 of the hormones, estrogen and progesterone. The 2, they will increase the amount of blood flow to the soft tissue, to the gum tissue. That will cause, we can see redness, we can see easily bleeding, some type of, you can say overgrowth, which is called gingival hyperplasia. In this situation, it's exaggerated because of the large amount of blood flow and actually the reaction of the soft tissue to the microorganism or to the irritants in the plaque will increase. Now, this gingival hyperplasia or overgrowth is more pronounced, especially when patients are mouth breathers. In mouth breather, definitely they need to see the ENT. In hyperplasia, if it's become too much, then sometimes surgically we may have to intervene, and this would be with gingivectomy or some kind of procedures. Now, the second stage would be menstrual cycle. During menstrual cycle, again, especially we see the increase of progesterone. This is more under that influence of progesterone. Again, increase of blood supply to the gingiva. You can say hyperreaction of the gingiva to the irritants, and we see bleeding and redness, and especially during brushing, they have more of a bleeding with it. When they take birth control pills, they have large amount of progesterone, so the same effect will be seen on those patients. The next step would be pregnancy, which there are lots of studies and researchers about periodontal disease and pregnancy, especially because lately there have been some studies that they are associating periodontal disease with low weight childbirth, and sometimes they say premature birth. Of course, these are just studies. Association has been there, but it's not completely proven. What happens during pregnancy? We can see changes in hormones, especially, again, progesterone is one of the major one. In this situation, of course, there would be lots of changes in the oral environment because of the way that the patient may not have that kind of motivation to have a good oral hygiene and all of this. So we see some kind of gingivitis, which is called pregnancy gingivitis. The other situation that we see some kind of overgrowth of soft tissue, which they call it pregnancy tumor, which is actually not a tumor. Of course, the name is pyogenic granuloma, which can be seen in the oral cavity or sometimes in other parts of the skin. Now, during pregnancy, it is very important for the ladies to make sure that they will see their dentist more often, they pay more attention to oral hygiene, and especially during the 2nd trimester and the early 3rd trimester. It's important because of these studies. Definitely we encourage them to see their doctors more often. Now, also in old ages, actually, they used to say a tooth per child, because the ladies were losing 1 tooth during every pregnancy because of the changes in their oral hygiene condition. And of course, the Danish, they have the same say that they are actually saying a child, a tooth, which is scientifically is not correct, and there is no reason for that. Now, the next stage would be menopause. Menopause, there would be lots of changes. The age has increased, the hormonal production is decreased. Because of the age, there are other medical conditions that the patient are taking medication for, that they could cause some kind of dryness of the mouth, and sometimes, or more common we see, they call it tongue burning sensation, which we can see it in those patients. With that, especially because of the decrease in the amount of estrogen, it affects the density of the bone, which in the oral cavity also can be very well pronounced. Now, again, it's important at this stage to see their doctor if they have some of these symptoms. As I said, especially because of the dryness, there is possibility of more of the cavities, especially root caries is more common among the elderly patient. Now, with all of this, so what should we do? The first thing would be really patient education is the most important thing. The patient should be educated about what we have talked about. The other important thing would be a good diet, which is always part of the health. The other important thing would be also very good oral hygiene, especially during these stages that we talked about, and certainly visiting your doctors more often. Thank you again for your time. We will see you next time.